Welcome, everyone. If you can, as you're logging in, go ahead and put into the chat your name and possibly what state you are from. We'll get started here in just a minute. All right, I think we're 1 minute past, so we'll go ahead and get started. Welcome to the Public Policy Update webinar. I'm your Capitol News Live. For those that don't know me, my name is Jennifer Braun. I am the chair of the Public Policy Committee for NASHIA. If you didn't hear me just a few minutes ago, before we get started, we would like for you to each enter your name and the state that you represent in the chat box. Also, if you have any questions in regards to the webinar today or comments that you would like to leave, please feel free to include those in the chat box. There is also a Q&A option that you can use. And so if you have a specific question, please feel free to use that as well. We hope to have time at the end of this webinar to have an opportunity for you to ask questions and us to do some answers. The materials from today's webinar are located on NASHIA's public policy website. I'm not advancing slides. I'm not doing very good today. The materials from today's public policy webinar are on the public policy website. The link to that website is in the chat for you to reference. But anything we discussed today will be included on our website for you to access afterwards. NASHIA does have a public policy committee, if you are not aware. With this committee, we meet and discuss legislative priorities for NASHIA. The committee meets on a quarterly basis. If you are interested in joining that committee or want to have more information about the committee or just interested about the committee in general, please don't hesitate to reach out to myself or to Susan Vaughn. On behalf of the Public Policy Committee, NASHIA is also involved with multiple national coalitions, such as the Consortium of Constituents with Disabilities, Injury and Violence Prevention Network, Disability Rehabilitation Research Coalition, and American Brain Injury Coalition, and many, many others, just to name a few. Also, Zeta is not able to join us today, but Zeta Ricker is NASHIA's public policy governmental consultant. Zeta helps us on Capitol Hill. She works with Rebecca Wolfkiel, our executive director, and who will be detailing some of the efforts that her and Zeta have been working on later on in this webinar. All right. Members of NASHIA, if you haven't already been receiving these, will receive many publications in regards to public policy. For example, the Washington Weekly is sent out to all members on a weekly basis to inform you of activities and action items that we are currently working on or that are happening at the Capitol. If you ever have questions or would like additional information or just additional copies of any of the publications or action items that we do send out, please don't hesitate to let someone at NASHIA know, myself, Susan, Becky, or whoever, Amanda. Let's see here. All right, NASHIA's priorities. Each year, NASHIA members discuss the legislative priorities for the upcoming legislative cycle. We are currently in the 117th Congress, and some of the public policy priorities that we are working on and that we said that we were going to work on are to enhance and expand state capacity to provide services and supports, improve services for underserved populations, improve outcomes for individuals in juvenile and criminal justice systems, The public policy priorities brochure can be found on the public policy page that is listed in the chats. And but we work on tons of things happening throughout the year, and you're going to hear about many of those activities later on from Becky and Susan. All right, today's objectives. So this webinar will include providing an update on the fiscal year 23 appropriations, other priority legislations, and recent administration policies that are in place. We will also discuss details about NASHIA's Public Policy Committee and ways that you can advocate even as a state employee. And hopefully have time at the end of the webinar to answer any questions that you may have. But please remember to put those questions in the chat or utilize the Q&A option that we have at the bottom of your screen. Okay. Today's presenters are Rebecca Wolfkiel. Becky is NASHIA's Executive Director. And also we have Susan Vaughn. And Susan is the Director of Public Policy for NASHIA. So I'm going to turn it over to Becky now.
Great. Thank you, Jennifer. I'm so pleased to be able to join you all today. As you, if you've joined these webinars in the past, you know that Zeta Ricker typically joins Susan and Jennifer for these updates. And unfortunately, Zeta had a family emergency that she needed to tend to this week. So I know she was disappointed not to be able to be with you all today, but I'm very pleased to be able to be in her place and get to talk about my passion, which is public policy. Susan and I have been working on NASHIA's public policy goals for over a decade, maybe approaching 2 at this point. And so it's really exciting to be able to talk about how our priorities have evolved and how we continue to ensure that NASHIA and the brain injury community are even more represented today and continue to expand our reach on Capitol Hill. So next slide, please. So I think most of you know, if you joined our updates in the past or have been involved in our public policy committee, sort of the foundation of our congressional efforts really are centered around our Congressional Brain Injury Task Force. And we are truly very fortunate to have dedicated champions on Capitol Hill in Washington, D.C. that we can go to and talk with them about priority policy areas that we really feel need to be addressed related to brain injury. And, you know, most of the time, if they can be, they respond and they try to create legislation based on what, you know, we representing the community tell them the needs are. And so a lot of what we'll talk to you about today, you'll notice these 2 names are associated with because they really have been champions for us over the years and truly, you know, are sort of point folks on Capitol Hill advocating for increased funding and increased recognition as it relates to brain injury. I think you're all familiar with Congressional Brain Injury Awareness Day on Capitol Hill. That is created and managed by the Congressional Brain Injury Task Force. And throughout the year, they also host congressional briefings to help try to educate other members of Congress about the prevalence of brain injury and its connection to other policy areas as well. Next slide, please. So you will note that, you know, the appropriations process on Capitol Hill is really sort of the foundation of, you know, of all policy. Congress works. It's a, you know, full-time Congress, like some of your state legislatures. So they're working, you know, round the clock on policy initiatives, but without funding for those initiatives, you know, they really don't have much teeth. And so we spend a lot of time really focused on appropriations and ensuring that the policies that are currently in place and the programs that are currently in place that support states and support people living with brain injury, that there's funding associated with those programs. And so this slide sort of gives an overview of the congressional budget process. And so, you know, it starts in a traditional year, the president will put out his his budget request in the spring, usually around April. And then the House will need to work to put together a budget resolution, which really is sort of what we call top line spending. So for every budget account, the House needs to put together a maximum spending level that the committees and the appropriations leaders can really use to, within that top line number, adjust spending. And so, where our work really comes into play most is this third line item, when the appropriations committees really get to work to take that top line number and start to splice it out into specific accounts. And so we, with your help, often, we try to get congressional folks on Capitol Hill to express their support for funding for the programs that support folks with brain injury. So as you know, our ACL program, our Administration for Community Living, TBI State Partnership Program is a priority funding line item for us, as well as our CDC TBI program and NIDLR research. Those are our top three areas that we're working really hard to try to continue to plus up funding levels for. And thanks to our Congressional TBI Task Force in the Senate, Senator Van Hollen, those offices serve as our leaders, and they try to garner additional congressional support to show the Appropriations Committee that there is strong interest from Congress to fund these programs. The work that you all do is critical, reaching out to your members of Congress, having meetings with your members of Congress, attending Congressional Brain Injury Awareness Day on Capitol Hill. All those interactions with your members of Congress to let them know that the need is much greater than what the funding currently reflects. And it really is imperative that these programs receive more funding so that we can build capacity in states and we can get a better sense at the CDC of how many people are living with brain injury, so that we can continue to serve people across the country better. So I'm sorry, I digressed a little bit, but the timeline for each of these right now in June, we're at step 3. So the subcommittees, the appropriation subcommittees are currently meeting, and they'll create baseline budget bills specific to these programs, and then they'll pass it to the full appropriations committee. We're working through the House right now. The House always begins this process, and within the next month, we expect to see our appropriate budget bill that contains the programs that I mentioned emerge from the House Appropriations Committee. And at that point, we'll get a sense of what the House has allocated for our programs. It will then, after it passes through the full House, it will move over to the Senate, where it will go through a similar process. And hopefully before the end of September, we'll see both the Senate and the House bills conference together, which negotiated, and there being a final version that is passed by Congress and signed into law by the president. It is an election year this year, so oftentimes on election years, we don't anticipate a lot of late year action, which can often mean that the budget would result in a continuing resolution, which basically means that the same funding levels from the previous year are carried on to the next year. We do believe, though, even though it's an election year this year, that we may actually have a fighting chance at having a budget with increased funding levels, because there are some really important, not important, everyone is important. There are some senior senators and members who are retiring this year, who are on the appropriations committees and really are hoping to see a final bill passed as their swan song as they retire this year. So we're continuing to keep momentum up related to our budget advocacy. Next slide, please. So these are the three programs that I mentioned are really our priority programs. There are so many important programs that support the states and individuals living with brain injury. We are small, so we have to really prioritize. And these are the three programs that we prioritize each year. We have gained progress. As I mentioned, Susan and I have been at this for quite a long time, and we have seen strides. We have seen increases in the program. Even last year, we saw small increases in all three of these programs. And the ACL TBI State Partnership Program, the small increase that it received resulted in an RFP or a FOA going out to be able to fund a couple of more states. So even small increases make a big difference, and we'll continue to advocate for more increases until there's enough funding for every state to have funds. Next slide, please. So while appropriations is truly, a fundamental piece of our advocacy work, there are other bills and other efforts that we've been able to get very invested in and really move the needle on. And this year in particular, it's been very exciting. And again, I'm sorry that Zaid is not here today to be able to share her thoughts about these bills, because she really has been instrumental in ensuring that we've been able to have these efforts, but I'll do my best to fill in for her. So the TBI PTSD Law Enforcement Training Act is one that's actually been around for a couple of congressional sessions, but this year has a real fighting chance at movement. This bill, which we've been supporting and leading efforts from day one, is really important and would ensure that there is crisis intervention training, a model developed through the Federal Department of Justice, and then funding to help states train law enforcement and first responders on how to better recognize and interact with folks living with brain injury and PTSD. We've joined with the law enforcement community to advocate for this bill, and it's been a really wonderful partnership. So this bill did pass the House this year for the first time, which we are super excited about. And now we're told that we have a good chance at it moving through the Senate as well. We're in regular discussions with the Senate Judiciary Committee, and we're told that as early as next week, it may be able to be passed through the committee, which once it's passed through the committee, we can move to the full Senate floor. And if we can pass that hurdle, then it goes on to the president's desk. So very, very exciting effort and a true collaboration with the law enforcement organizations. And I think Cheryl Kempf is on with us today, and she's really been a true leader in this effort as well. And we are working to have meetings with members of the Senate Judiciary Committee as well, and targeted states that we really need some help making sure they'll support the bill. So, we'll likely reach out to folks, and we have been reaching out to folks to join us for some of those congressional visits. The other bill that is moving this year that we're very excited about is the Protecting Survivors of Domestic Violence from Brain Injury Act. This legislation is a follow-on from a GAO report that was released in I think 3 years ago now, 2 to 3 years ago. And the GAO report was it conducted an overview of what states and the federal government have done to better understand the correlation of intimate partner violence and brain injury, and then to get a better idea of what supports are out there. And basically, the number one recommendation from the GAO when it released this report was that we need a better idea of how many people truly are impacted by brain injury as a result of intimate partner violence. We know that it's a huge challenge, and we know anecdotally and from some state data that it's a huge challenge, but we don't have any national data. So this legislation would allow the CDC to conduct a study and get a better understanding of the true magnitude of this challenge. We've been very involved with the Senate Help Committee, urging them to move this legislation along. They are very interested in the bill and are running the traps right now through the Senate committee to try to see if it's something that they can get passed this year. And, you know, we really believe that if we can get it through the Senate, then we should be able to get it through the House after that. So again, it's something that it's very exciting. It has real traction this year. And if you're interested in joining with us and advocating, please do reach out to us after this. And we'd love to bring you in and help with our advocacy efforts. The Able Age Adjustment Act is you may be aware of ABLE accounts, and ABLE accounts are savings accounts for individuals with disabilities. It allows for some tax-free savings for the individual so that they can work and save some funding. Right now, individuals who have sustained a disability before age 29 are the only individuals who are able to access and use these ABLE accounts if you live in a state that also allows the ABLE accounts. But the federal legislation does have that limitation to it. And so this Able Age Adjustment Act would allow individuals who have sustained their disability before age 49 to access. No, Susan's shaking her head. No. Well, Susan, then why don't you pop on and correct me then?
I was just going to put it in chat. It's actually age 26. It has to be up to age 26, and it cannot be past 46 in the new law. I mean, it extends it to 46. And I'm sorry, because I was just going to type it in the chat. I'm sorry.
Okay.
So the current law is 26, and it's going to change it to 46. 26
to 46. Apologies about that. But obviously that's important as folks sustain brain injury at any age, and even older than 46, but 46 is certainly a big improvement. So we have been very engaged trying to support the Senate Finance Committee, who is apparently going to be considering that legislation today. And so we have been trying to work on Senate Finance Republicans, encouraging them to allow for this legislation to be passed today. Again, if this is something that you're interested in joining forces and helping us support, we have draft emails set to go and can help connect you with your member of Congress to show that there is support for this important bill to be passed. Finally, WIOA, the Workforce and Innovation and Opportunity Act reauthorization. I'm sure many of you know this is really a pivotal bill that provides resources and programming for individuals with disabilities to be able to get back to work. And there is an effort right now to reauthorize this program, specifically in the House. It appears to have a lot of traction. If I'm being honest, I'm a little leery that we'll be able to get something through the Senate this year, but we're going to continue to advocate for its reauthorization because it really is critical to ensuring that there are programs to allow individuals to get back to work after sustaining a disability. So next slide, please. So those were some specific bills that we've been very engaged in trying to move this year. In addition to those bills, there's also public policy efforts that we've been trying to integrate our brain injury public policy efforts into. And so one of those is long COVID. As you know, I mean, there's a lot of attention right now on trying to figure out what long COVID, even looks like. There's a lot of funding going towards research right now. And, we're really trying to ensure that the cognitive deficits that are associated with long COVID are part of the discussion, and that folks are understanding that, if someone has residual brain injury from long COVID, that they're going to be receiving and looking for resources in their state. And so states need resources to be able to serve those individuals as well. And, trying to connect those dots as we're talking about long COVID in Washington, D.C. Same as Havana syndrome. I'm sure many of you are familiar with Havana syndrome, which is related to anomalous attacks, specifically, radio waves or waves that, and most times are diplomats overseas, specifically in Cuba, Havana, Cuba, but also happening in Russia and China, are receiving, incurring brain injuries, really significant brain injuries as a result of these anomalous attacks. And so what's being dubbed as Havana syndrome. And so Congress has been, they did pass one bill to fund some acute care for individuals who have been, who've sustained Havana syndrome and are living with the impact of Havana syndrome. And, our discussion point with the congressional members is that, again, acute care is super important. We need to make sure that those individuals have the care that they need. Once they're released, they are going to go back into their communities and they're going to need resources. And so state governments and their partners need funds to be able to create systems to support those folks. And that, has seemed to resonate. Also, just making sure that Department of State knows that we have an ACL program, we have a CDC program, there's VA programs. We should all be coordinating together. We don't need to reinvent the wheel. And so again, there's been receptivity towards that, but there's certainly more that we need to do. And finally, if you attended our Congressional Brain Injury Awareness Day on Capitol Hill, Congressman Blumenthal, who joined us, talked about his Bringing Regulatory Advances into Neuroscience Act, the BRAIN Act, which would create centers of excellence across the country to do some more advanced research and translational research related to neuroscience. And thanks to their partnership and the Neuroscience Caucus's partnership with the TBI task force, we were able to get some language included in this bill to ensure that TBI in particular is part of this neuroscience research, and that stakeholders from the brain injury community are at the table throughout the process. So another exciting bill. I'm not sure about its chances of moving this year, but it's at the federal level, as you know, it's a long game. And so we do think it's an important effort, and hopefully in subsequent Congresses, if not this year, it will be moved. Next slide, please. So I guess I'll just conclude by saying, I know we all see the news, it seems like a very bleak picture as it relates to what's happening in Congress. There is a lot of focus on gun measures. There's a lot of focus on the budget bill, but some things are still getting done outside of those big packages, and some things where you can bring a consensus together and there's not a lot of controversy around. We are able to chip away and make incremental progress, and maybe even, see a couple of those bills signed into law this year. So we remain optimistic, and we're excited to be able to focus on a diverse number of congressional policy issues. So with that, I am very happy to turn it over to Susan, who will talk more about home and community-based services and Medicare, Medicaid policy.
Thank you, Becky. I think it's fitting the day before the anniversary of the Olmstead decision, which was signed on June 22nd, 1999, that we're going to talk about a couple policies and the role of Medicaid in particular to help states promote community living for long-term care and services. So I'm going to talk about a couple things that has just happened. Jennifer talked about some of the coalitions that we are involved with as NASHIA. We also are representative on a monthly and sometimes more group with other national organizations and state directors like Medicaid, developmental disabilities, mental health, to name a few, and Medicaid, that convenes these meetings with the national associations that represent state programs to discuss their policies around home and community-based services. And so there's been a couple policy or changes this last few weeks, a couple weeks with regard to deadlines that I'm going to talk about today, and then talk a little bit about maybe some opportunities for you to be able to help have some impact on that at a state level. The first one is the 2014 Home and Community-Based Services Settings Rule, which has been around, as you can see, for 8 years. And that rule had three components to it. The first one was the person-centered planning, which went right into effect to put the person or the beneficiary of Medicaid home and community-based services at the front end of person-centered planning and control. And when I talk about home and community-based services home and community-based services, it's not just brain injury waiver programs, because it applies to any of your state plan services like I, J, and K that also offer home and community-based services. It applies to your Section 1115 waiver programs, demonstration waiver programs, anything that is dealing with home and community-based services. So even though we only have about half the state that has a specific brain injury services waiver, a lot of folks with brain injury are served by other waiver programs, or they're served by state plan services. So these policies will impact them. So the person-centered planning was the first thing that went into effect. The second was the conflict-free case management. I think it came on board to be implemented a couple years later. And just as it implies, it basically says a provider of a service cannot be case manager of someone of which they're trying to develop services for, because obviously that's a conflict. The third one that's been a little longer to try to get implemented is actually settings. What constitutes community settings in lieu of institutional services? And I know that sounds kind of like it'd be easy to do, but we're dealing with populations of aging, disabilities, developmental disabilities, and of course, brain injury. And particularly with the aging community and assisted living programs, to try to ferret out what seems to be community is sometimes hard to figure out. So what's happened over the last few years is the states are supposed to have had public hearings. I'm hoping some of you participated in those, to develop a statewide transition plan that would talk about how they're going to go about ensuring that providers offer some community opportunities for people that are receiving those services. And by that, they mean that people have a right to privacy. They have a right to choose their own roommate if he or she has one. They have a right to have visitors. They have a right to have access to food. All the kinds of things that most of us that are living our own homes have, that these people also have within these settings, that it's all integrated, and they have opportunity for employment. There's a big move on integration employment and getting out of sheltered workshop settings, getting out of day program settings, but into the communities. So the states have been developing these transition plans. They were supposed to have been done right before COVID. And because of COVID and the impact that had with the public health emergency system, recognizing that people could not go into people's places, that it was impacting direct service providers, support professionals. A lot of this was kind of waived. And so a couple of weeks ago, they extended the deadline to 2025. And states are to have their transition plans approved. They do have a correction plan if it's related to the public health emergency that states can apply for, but it truly has to be related to that. And what happens if states do not meet this compliance, they get their federal match cut off. That's the carrot or the incentive for states to make sure we have compliance. And in those compliance with those plans, they have to tell how they're going to change their licensure standards, any kind of certification that providers have to adhere to that will meet this requirement, and how the states plan to monitor that from ongoing once approved. reported last week at this meeting that CMS, the Centers for Medicare and Medicaid Services, has selected some states to do on-site reviews so they can actually see some of these settings and where people are living and working and participating in the community. I thought it was interesting because a couple states had put in their plans that they had no problems. Everything was met and according to Hoyle, and they actually got letters from stakeholders in those states. So that's why they're visiting some states, because some stakeholders believe that not all these settings really are meeting these criteria. So I thought that was interesting. I was telling Jennifer before I came on to this webinar that I got an email from Medicaid that listed that I guess all the states have turned in statewide transition plans for initial approval, but not all states have received final approval. And there was a few states mentioned that who have submitted waivers that have put some programs in their waivers that look like they had institutional bias. So they're really paying attention to this. In other words, if it's a state operated nursing home, or they're looking at childcare facilities, if it implies that it could be an institutional bias, then they're looking at it before they approve waivers. So this is really important to get this put in place to ensure that people have opportunity of choice and community integration. The other thing is the enhanced American Rescue Plan. And I don't know why I reverse those letters all the time, because that's really has to do with interest rates. I think I was on a credit union board for about 12 years, and all I know is APR. It has to deal with interest, but it should be American Rescue Plan. So Becky's not the only one that gets the numbers turned around. It was me that did this on typing. And this has to deal with the federal match that was put in that American Rescue Plan. We actually had this in the webinar last year to talk about in June. The opportunity in that bill that provided states a 10% enhanced rate on their home and community-based services that they offer, whether it's a state plan service or a waiver service or any of those other plans that I talked about a while ago with 1115 or IJK, any of those efforts. If it's a home and community-based services related, then the states were eligible for 10% more in state and federal match. And the thing is, they had to turn around and use that for improving and expanding home and community-based services. And again, that had a quick turnaround time. States had to do spending plans. They had to do public meetings and get input for stakeholders, how they were going to spend that money. And because of the COVID pandemic lasting as long as it did, they've also pushed that back to March 31st of 2025. And so the next slide will show you how states are using this money. Most states have increased provider rates with it, and that's true with the brain injury community, with the providers under waiver programs. Some states have expanded eligibility, and a couple of states that means they expanded services for people with brain injury by creating some new services for people. They have tried to strengthen direct care workforce and paying benefits, eliminated waiting lists in many states, expanded coverage services, and et cetera. And this is a long, what I want to call it, web address where you can see an infographic that Medicaid has put together. It's really kind of interesting because they have some narrative and examples of states, what they have done and where that money is going. This PowerPoint is on our website, so you can see it if you need to look up and see this this link, or you can go in and just say home and community-based, just say this, home community-based services infographic, and you can see all the ways the states have used this. And the reason I'm telling you this is because with this expanded deadline, it's opportunity to still have input into spending plans as states continue. So the next slide gives you some examples of what you might want to do. I did have a family member contact me last year after we had this talk, and she got right immediately in contact with her Medicaid agency to provide input. But with the advisory boards and councils we have, it's a really good way to use those boards. Many of these boards have members of the Medicaid agency on them. But if not, invite them to come talk about their spending plans, what they're doing with this enhanced rate. I would also suggest you educate your stakeholders to know what all this means. I would educate them around the settings rule as well, but I would also educate them about what this enhanced match means for opportunities to get some home-based services for people with brain injury. As I said, they are still working on spending plans. One of the things I noticed on applications to Medicaid, whether it's a waiver amendment or a state plan amendment, there's a provision in those applications that it says, you know, public hearings, public input, and the state has to put in there when they notified the public about what they were changing and what the input was that they received. And then they have to answer whether they took that input or not. And I will see a lot of people want to know, why isn't there more services for people with autism, or why there's not more services for X, Y, and Z. And I very seldom see about brain injury. So that's a real good place to make sure that you provide input. And if you're wondering about that, I would call your Medicaid agency and see if they have a list where they notify people about these public hearings. Some states may do that. They'll keep a list of who they have to notify. In our state, and Jennifer can correct me because I've been out of our state government for so long, but there was always requirements that anything was notified through so many newspapers and so many ways to get things out to the public when there were changes in rules and regs in Medicaid. So that would be a way to do that, is to make sure your name is involved or is on that listing. So if public hearings come up and they talk about spending plans, increasing services, expanding services, you have a way to provide input. And then I would also say coalesce with other disability and aging organizations. Jennifer talked about what NASHIA does at the federal level. It enables us to be able to support other issues. Becky outlined a lot of issues that we're directly involved with, but we cannot be involved with everything, whether it's falls prevention related or whether it's other prevention related issues. We use our input to the coalitions we work with as a way to put in our support or to add how that affects brain injury. You can do the same thing at the state level. And Jennifer's going to be talking about this after me, and she can give you a little sense of how she operates as a state employee, the kind of ways that she's partnered and networked and coalesced with other similar organizations in the state in order to make sure brain injury is at the table. So that is the extent of my presentation on how federal policies can help people at the state level and to get involved. And I'm going to turn it over to Jennifer to talk to you about what further you can do to help with public policy within the state and as a state employee. Thank you.
Thank you, Susan. All right, so now we're going to talk about how you can get involved in ways that you can be involved, whether it's at the federal level or even just your state level. In most states, if not all states, there's a disability council. So like your developmental disabilities council, there's coalitions that you can partner with to learn more about legislative efforts and activities that are being done in your state. I know in my state, we have a Missouri Brain Injury Advisory Council, and I know quite a few other states also have brain injury advisory councils. Within our council here in Missouri, we partner with quite a few other state agencies, as well as our Governor's Council on Disability. The Governor's Council on Disability, ours is really fantastic. They provide us with monthly, if not bi-monthly updates about what's happening in state legislation, what we need to look out for, what's going to vote, what has voted, what the bill numbers are, so you don't have to search for it and all that good stuff. So they are a great resource for us here in Missouri. The ways that you can advocate, partner with everyone and anyone that you possibly can. As a state employee, Just because you're a state employee does not mean that you cannot advocate in your state. You are still a citizen of that state. You are still a constituent of the state. See, I can say the word constituent. I couldn't before. But you can always email your state senators or your representatives. Just make sure you don't do it on your work computer during normal business hours. You know, go home at night, and while you're sitting there flipping through Facebook or Instagram, you know, when something's going on, email one of your state legislators and say, look, this is important to me. I know Cheryl does it, you know, and granted, she's not a state employee, but look what efforts she has put in and what has happened because of those efforts, you know. And so there will be much support, you know, from everyone. But yeah, if you have any questions about that, we do have a publication that's dedicated to how to advocate as a state employee on our public policy website. So feel free to download that, print it. If you have questions, reach out to myself. I go to DC every year prior to COVID, I guess, and, you know, and met with my senators and representatives that, you know, on Capitol Hill. And there's nothing that says that you cannot do that. Just be responsible in how you do it, and don't charge your time to the state whenever you do it. But there are tons of other ways to advocate. You know, each state has a brain injury association or a brain injury alliance. So partner with those agencies, you know, and they advocate so much. And so if there is an activity or if there is legislation that is important to you or that you would like to see through, partner with them and see what they can do to help out and how you can help them as well. On our public policy page, there is tons of materials about legislation and different things. And so feel free to download that. If there's anything that you have an idea that we can publish for you, or maybe a brochure could be made up that you can take with you, just let Susan or I know and we can help you out with that. I know whenever we go to our state representatives, we always try to provide them with some material, you know, like the data that backs up what we are asking for, you know, and just the importance of brain injury in our state and brain injury services in our state and so on. And so, yeah, if there's anything that we can do to help you out, please just let us know. All right. I feel like I missed it. Oh, there it is. Sorry. I was like, I missed the slide here. One thing I did want to mention is that we are currently accepting nominations for the William A. B. Ditto of Excellence in Public Policy Award. And so this award recognizes NASHIA members who have significantly impacted service delivery for individuals with brain injury due to public policy advocacy. So if you have someone in mind that is doing this in your state or has done some fantastic legislative priorities in your state, please nominate them. There's nomination forms available. You should be receiving an email from NASHIA about the nomination application. Those will go to the public policy staff, will review, and we will give that award out during the State of the State conference this year in September. So looking forward to that. In addition to the public policy committee, in addition to everything else we already talked about, the Public Policy Committee is working on the priorities for the 118th Congress. And so if you have specific suggestions, recommendation, ideas that we can do as far as priorities, please send them to myself, Susan, Becky, anyone at NASHIA, and we will review them. We will submit the priorities that we come to as out to the voting members of NASHIA in September at that meeting. And so hopefully by September, we will have our priorities all figured out for the 118th Congress for next year. So if you do have ideas or suggestions, recommendations, please let us know. So it looks like we have about 11-ish minutes left. So I know there were some comments in the chat, but I didn't see any specific questions. But if you do have questions, feel free to put them in the chat. I think you can unmute yourself if you want to just ask the question. Give a comment. And if not, that's okay. Cheryl, I did not know you were a state employee. I'm sorry.
So Becky, can you tell them what people need to do in appropriations right now? Is there anything that people can do? Or are we in a wait mode to see what the House is doing right now?
That's a good question. No, I think we still need some pressure in the Senate to try. Last year, our House number was higher than our Senate number. And at the end of the day, when they negotiated, we wound up with the lower number. So we really need the Senate bill to have robust funding in it. If you would be willing to send an email to your member of Congress or your senator specifically, please reach out to us, and we will. We have a draft email already set to go. We can give you the staff email address, and then help you send an email to your senator, because I think, Susan, that's a good question. We still have time to make an impact on the Senate, and we should be funneling all of our resources that way and support.
And especially if you have a senator that's on Appropriations Committee or the subcommittee, the Senate and the House both have subcommittees that are on labor, health and human services, education related agencies, pensions. I left out, oh no, did I do that right?
Yeah.
I did. That's where our health and human services budget is. You can, that would really be helpful if you've got a member on that committee, and let them know what your needs are in the state. If you're receiving a grant, how that's helped, but what the continued needs are. If you're not receiving a grant, why you need to get one. Were those anything else that people need to know?
Yes, and thank you, Lori. You do have senators on that committee, so we'll follow up with you after this. And yeah, and really any Republican senator, if you are represented by a Republican senator, we can use your help.
And then I think there's a couple other things. I mean, I feel like now we're asking people to do things, but that's part of what this call is, to ask people to help. Becky, and particularly Zeta in her lobbying role is really on the Hill all the time, but you can see how many things we have interest in, and that's a big hill, isn't it, Becky, with 500 and some odd people. It's a big hill to cover everyone and every committee between appropriations and the judiciary committees. That was one thing I've had to learn come out of state government in the Capitol, is it seems like they have a committee for different interests for everything. So you just can spread yourself pretty thin if you don't have an army of people, and we don't have an army of people. So anything, I think that if you are especially interested on those other pieces of legislation, let us know and we'll help you walk through what you can email, or if there's opportunity yet to make a conference call, we will try to help do that. That's what Zeta has been doing a lot with the training bill. I think some of you on this call may have been involved with those calls. I know we have in Missouri, because we have somebody on the Judiciary Committee. So a lot of times what they do, if it's really something that is dire, we really need the assistance, she will help you set up that call to the staff so you can talk directly to someone who is on that committee.
Yes, and the virtual nature of meetings now makes it so that we can set up Zooms pretty easily for those of you who are willing and interested to do so.
Becky, did you see, or Susan, Liz is asking, is the GAO report on the website?
I just
I think your response.
Yeah.
Sorry, thanks.
Yeah.
I think it is too, though.
Yeah.
I think it's on the public policy page, but our public policy page is a little busy. It's got a lot of information on it. So you almost have to read down and see where some of those reports are. And the same thing on everything else. We have handouts on appropriations. We have verbiage. We have handouts on the bills that Becky talked about. But sometimes figuring out what's what gets a little overwhelming. So I'm happy to help, like who was it? Lori suggested having some verbiage specifically, and that will save you time from trying to figure out where it is that we're talking about. But we have a lot of information on our public policy page. So we're happy to help you zone in on what you need.
And Tracy, yes, we will reach out to you and help you with write-up. And the recording or the webinar today is being recorded. So we will upload it to the websites as soon as we can. The PowerPoint is already on the website for you to access though.
I'd like to put in a plug to, I try every so often to do a state news. I kind of like to know what's happened at the state level. If you have legislation or got additional funding in this past session, if you don't mind sending that to me, I think my emails, did you all know my email? It's svaughn@nashia.org. I would appreciate it because it's hard sometimes for me to keep up with state legislation, but I like to share that with our members. And I know that's kind of a side note, but it's kind of like, well, you got people here, you can kind of ask for other things. Maybe here, I'm going to put my address on here.
Jennifer did it for
Well,
you.
I tried.
Oh, thank you.
I only
thank you.
sent
You're
it to a
faster.
few people for some reason, not to everyone.
That's okay.
Let me
You're
read it.
faster than I am. Thank you.
I would say our last slide is about membership. So if you are not a member of NASHIA and are interested in becoming a member, don't hesitate to reach out to Haley Cushion. Her email address is on the screen there. Becky can assist. I can assist with getting you pointed to the right direction. You know, NASHIA is a great agency. We do a lot, not just in public policy, but education, awareness, you know, trainings, and so on. And so it's worth the time. So if you are interested, please don't hesitate to join NASHIA if you're not a member already. I think that's it, unless there's any other questions. I just want to say thank you for taking the time to join us today. It was good to chat with you all, and we'll see you next time.
Thank you.
Thank you.